Hi, my name's Kathleen Wabeck. This PowerPoint is for Spring Arbor University, Nursing Class 360, Information Management and Patient Care Technologies. The purpose of this PowerPoint presentation is to discuss ransomware, what it is, how it can negatively impact the healthcare industry, and ethical or legal issues it may cause. Ransomware is the process of breaching networks and encrypting files to restrict access, then ransoming the files for a fee. Ransomware was created in 1989 by Dr. Joseph Popp. He used ransomware to get money from groups who were interested in researching acquired immunodeficiency syndrome. Dr. Popp was arrested. However, other cyber criminals caught on and began using ransomware. It was first used on individuals, but has worked its way into larger organizations. Individuals, small and large businesses, and even government agencies have been hacked into by ransomware users. The healthcare industry is a huge target for ransomware criminals. They know that the data contains sensitive personal and financial information. As technology advances and federal policies are put into place, hospitals who upgrade their technology are at a higher risk for cyber attacks. Research shows organizations hoping to comply with federal initiatives are spending around 95% of their IT budget on implementation and adoption, while less than 5% of their budgets are spent on security. It is imperative that healthcare providers are aware of cybersecurity trends and threats as they surface. In the last 2 years, 90% of healthcare providers faced a data breach, and cyber attacks are up 125% since 2010. A ransomware attack took place at the Hollywood Presbyterian Medical Center in Los Angeles, California in February 2016. The hospital was forced to pay $17,000 to regain access to their patient data. The hospital was unable to take new patients and lost thousands of dollars in revenue. The Director of Healthcare Privacy and Security at Intel, David Huling, adds, "When healthcare does not have timely and reliable access to healthcare data, such as when it's encrypted due to ransomware, and they cannot decrypt it, healthcare is severely disrupted, certainly to the point where it compromises patient safety and even to the point where healthcare organizations have to send patients elsewhere. Further, healthcare is intolerant to such disruption and therefore likely to pay the ransom. As nurses, we can do our part to help out by being aware of potential cyber attacks. It is important that we do not open any email or link that we do not know the sender. Software should not be downloaded to hospital computers, and unknown USBs should not be inserted into computers. If there is a security breach, it is important not to panic." David Finn, a hospital health information technology officer at Cimatech, said, "It is not malicious intent on the part of the user, but I think it's a lack of awareness and a lack of training people on what they could be doing unintentionally to trigger a cyber attack. When they get an unrecognized email with a file they did not recognize, or they click a link that they don't know what it is, you have to train your staff to know how to spot potential concerns." The question, is a ransomware attack considered a HIPAA violation, is often in question. Health and Human Services was contacted, and their response was, because it is considered to be a breach if the information is merely acquired, and it is a disclosure under HIPAA if access has been provided, covered entities need to do the required analysis in each instance of whether a low probability of compromise has been demonstrated and whether the PHI was actually acquired or viewed. is one of the factors. Ethical and legal issues may arise because of a ransomware attack. Limited access to patient data could cause patients to not receive the proper treatment. System downtime can lead to an increase in medication errors, causing further harm to patients. Hospitals may see lawsuits from patients because their healthcare information was accessed without their consent.